Hi, everybody. This is Dr. John Pitts of the Centennial Schultz Clinic, where we lead and invented much of the field of interventional orthopedics and regenerative medicine, meaning we treat musculoskeletal orthopedic type problems with injections of your own healing factors or things that stimulate healing instead of using drugs with a lot of side effects or invasive surgeries with high risk. I've been just talking about different research and evidence for PRP and stem cells as a common concern we get from patients and mostly doctors who are just unaware of the field is that there isn't a lot of published data in this area, which is not true. So every single week there are several papers published on how PRP and or stem cells can be effective either clinically or in the lab or with animals. So I'm only going to focus on the clinical things as that's important and relevant for people. So today I like to talk about a study for hip arthritis. So just like any other major joint, the hip can get arthritic. The difference is hip arthritis progresses very quickly. So knees can progressively get worse and worse over time, 20 to 30 years. Then maybe they get too severe and need a replacement. Hips, they can go from no pain at all and then 2 to 3 years later, completely worn out and maybe looking at a replacement. So if you have hip arthritis or some hip pain and suspected arthritis, you want to get that evaluated ASAP. So it's usually better to treat this earlier once it gets a couple years deep and maybe too late. So this study looked at patients with hip arthritis that was in a mild to moderate range, about 33 patients. They randomized them to either receive PRP injections every week for 3 weeks or hyaluronic acid injections for 3 weeks. And hyaluronic acid is the lubricating fluid in joints. It can be injected. It's usually safe, but it doesn't provide any regenerative therapy. It can just help with pain. And the knees has been studied quite a bit, and it helps for several months. And there's some research that it can help with hip arthritis as well. So between those two groups, 19 got PRP, and 16 of those 19 patients in the PRP group were able to avoid a hip replacement after 2 years. 14 of those patients got hyaluronic acid, and only 7 were able to avoid hip replacement. So about an 84% success rate avoiding replacement in the PRP and only 50% in the hyaluronic acid. Also, the PRP group had statistically significant improvements in function, as well as a little bit improvement in hip range of motion, whereas the hyaluronic acid group didn't have much functional improvement and had a decrease in range of motion a little bit actually. So the PRP was actually doing something to help improve the condition, whereas the hyaluronic acid maybe help with pain and still delay the hip replacement in some patients, but not the majority like with PRP. And then the details matter. You know, the PRP that they used in this study was low concentration, 2 to 3 times. We know based on evidence for arthritis, you want higher concentrations. So the Centennial Schultz Clinic will often do 10 to 20 times concentrated, especially for a hip. And when things in the hip are getting more than just moderate arthritis or moderate to severe, then stem cells will be needed. If it was on the bigger side of severe, then that might be too far gone for stem cells at all and maybe require a hip replacement. So this is just another study that shows even low concentration PRP can help quite a bit. So if you go to someone like us that does it even more perfected, we're doing higher concentrations and customizing the therapy to you, likely to have even greater success. We've actually published on using bone marrow concentrate to help hip arthritis and found that was helpful. Found that it was better if we caught the hip arthritis earlier in younger patients for this particular joint. So again, you want to get this hip evaluated sooner rather than later if you suspect arthritis or having hip pain. So if you or anyone else you know has arthritis in the hip or any other joint, has any other tendon ligament problems, we're the experts at diagnosing and treating these things in regenerative matter. Give us a call and see if we can help out. You guys take care and have a good day.